I'm an ophthalmologist, which means that I'm an eye specialist, and needless to say I need to care for people's eyes no matter what the problem is. But my area of special expertise is cataract and refractive surgery. So refractive or corrective eye surgery are the procedures that we use to give people the ability to see well without having to put glasses on or to put contact lenses in their eyes. Obviously the best candidates for this sort of procedure are adults. So young people that are 18 or 19 years of age, there's no upper limit as a matter of fact. It's difficult to know whether a person's eyes are suitable for the procedure without performing a thorough ophthalmic or eye examination. But as a rough rule of thumb, I would say that if a person has no history of any sort of eye diseases and can see well when they put their glasses or their contact lenses on, more than likely they'll be suitable for the procedure. Whereas if they've had some sort of pathology, some sort of disease in the eyes, then it may be less, they may be less suitable for these procedures. To have cataract or refractive surgery requires very little preparation. If we're using laser, then it's a virtually walk in and walk out situation. If we are implanting lenses into people's eyes, that's done in a very sterile environment, in a day surgery facility or a hospital surgical facility. And obviously there's the usual preparation. We ask people to not eat for 6 hours or so beforehand, and there may even be some drops to use beforehand. The procedures themselves are very quick. Most of them take no more than 15 minutes. Of course, the patients are in the facility for a little bit longer to make sure that they are comfortable before they go home, but they go home certainly within the hour and sometimes within minutes of having their procedure. In terms of how much time they need to take off work, or if you like, that period where they need to take it a little bit easier than usual, it all depends on the procedure. Usually people can go back to work not the next day, but the day after. But sometimes people go back to work even the next day. We almost always examine the eyes that have been operated on the next day, so the patients need to come and see us first anyway. Of course, every procedure has a certain degree of risk. Fortunately, these elective procedures, laser procedures and lens implants, cataract surgery, are extremely safe operations. I guess that's what gives us the confidence to operate on people who have otherwise perfectly healthy eyes. Now, with regard to the costs associated, it all depends on which operation we use. Some of these things are partially covered by health funds, and so a person may be out of pocket only a few $100s. Obviously, there are some procedures that are considerably more expensive. They may be $3,000, $4,000 or even $5,000 per eye.